Hello and welcome everybody to Transforming Healthcare. The people behind our progress, our HSE Technology and Transformation video series, where we highlight the people and programs driving digital change across our health service. Today I'm delighted to be joined by Professor Peter MacMahon. Peter is a consultant radiologist at the Mater Hospital and clinical professor at University College Dublin. Peter has been a leading voice in how artificial intelligence is being introduced and applied in radiology, with a strong focus on improving diagnostics and delivering better outcomes for patients. We're really looking forward to hearing his insights on how clinical teams are working with digital tools and how this is shaping the future of care for both patients and staff. Peter, maybe we'll start by, if you would tell us a little bit about your clinical background and what brought you to your current role at the Mater Hospital.
Yeah, so I'm a radiologist, so I specialise in the analysis of medical imaging and also performing procedures using medical imaging. And I trained in initially UCD and then moved on into the Mater Hospital, where I did most of my training in radiology. I then went to Boston in the States and worked at one of the major teaching hospitals there with Harvard called the Massachusetts General Hospital. And there I did a specialisation in emergency imaging, which was unusual at the time, and now is more common. I was probably the first person in Europe to kind of specialise in the emergency imaging as a speciality. And then I came back to Mater and essentially was appointed as a specialist in emergency imaging. And the Mater is essentially the biggest emergency department in the country at the moment. So I've that background. I also do sports injuries, spinal injuries, bone tumours, things like that. And that's my specialty. So I've kind of come to the Mater with that kind of emphasis in my approach to the clinical care. Emergency imaging, how do we make diagnosis quicker and how do we make the biggest impact to patients, especially in the emergency department or in other kind of acute situations?
Peter, you've spoken previously about how radiology has changed over the years. How would you describe the impact that digital technology and more recently artificial intelligence is having on clinical decision making today?
Yeah, so radiology has generally been kind of the pointy end of digital transformation in healthcare. We were very early switching from the old style floppy x-rays to now a digital x-ray. And that's probably around the world we transferred to that about 15 years ago. So that essentially all radiology departments around the world are digital nowadays. They virtually never use the hard copy floppy x-rays which we're used to. And so we've had a digital system for at least 15 years in Ireland. And so that has allowed us to kind of piggyback on that digital transformation of the imaging from hard copies to digital, allows us then to implement digital tools on top of that imaging. And so for at least a decade, we've already been applying different tools that analyze the images in a very rudimentary manner. But it started with just basic measurements and basic kind of windowing or changing the brightness and contrast of the images, things we couldn't do with a hard copy. It was just a photograph essentially that you couldn't really change. But now we can manipulate that image. And also, one of the big benefits of digital is that it's stored and then remotely accessible. So, for example, if you have an X-ray in Letterkenny, I in the Mater can look at that straight away when it's stored in a system I can access, which obviously cannot happen with the old-fashioned hard copies. So that was a true transformation by bringing in digital care for radiology. And we've actually had it a long time now. And that kind of naturally then leads us to being ready for AI, because AI just needs digital data and it needs lots of data, right? So there's no AI tool you can just program on a computer and off you go. You have to have data and train it on the data. So a lot of medical specialties don't have a lot of digital data, but we do. And that's usually around the world. So that's allowed companies to develop tools with all these thousands and thousands of scans that they have. And so, as well as being able to have the data and be able to develop the tools, because the technology became so advanced recently in the last 5 years, they can actually do something useful for patients. Rather than it being a toy, it actually seemed to be useful. And again, because we're digital, it's not that hard to implement. Because we don't have paper charts or different things, we have one system that you can then put the technology on and see if it works. Doesn't work, you can take the system off. And there's a huge benefit of just having digital healthcare, especially in the era of AI.
Radiology is one of the first specialties to see practical applications of AI. What are some of the most promising areas where AI is already helping improve diagnostics?
So AI is probably been around in clinical practice about 4 or 5 years, no more than that. And the first tools or uses it's being deployed in is diagnosis, so helping analyze images. AI is particularly useful at pattern recognition. So you give it lots of different studies, thousands of studies usually, it will learn a pattern. And we can teach it to learn a pattern, for example, for fracture. And so it can be taught that this is what a fracture looks like. And then what we do is we get that tool and we deploy it in our environment, which we have in the Mater Hospital. We have this tool looking at all our x-rays for fractures. And its job is to look at the x-ray and then flag a site on the x-ray it thinks has a fracture. So it's not making the diagnosis, it's essentially a triage tool. It's flagging a case as potential fracture, and it's to help the radiologist make the diagnosis. It also is flagging cases quickly for us. So you can imagine in a very busy emergency department, there might be hundreds of x-rays to look at. It's flagging the ones that we should look at first because it's analysed it straight away. So usually after the x-ray is obtained, it takes 2 minutes to get the result from the AI. And of course, it'll take hours usually for the human to kind of look to the x-ray and decide on a decision. So it's speeding up the diagnosis and then hopefully augmenting the radiologist in terms of their ability to detect fractures. Fractures that it might not have seen will hopefully be flagged. And that's particularly true, say, out of hours. So you can imagine it's 2 in the morning, you might be more junior, not experienced looking at x-rays, you're tired, lots of distractions. You have a second pair of eyes that's going to help you. It may not always be correct. And that's a big thing about AI at the moment, and it's a big part of the training with the use of AI. It's not always correct. So you have to understand that it's limitations. But once you understand that, and you understand that it's not always correct, but it is useful too, that it might flag something you've missed, that can be very useful. And so we've deployed it, and we've shown that that actually has happened, that we've improved our diagnosis and reduced the turnaround time from X-ray to diagnosis.
The HSE's Digital for Care programme is all about delivering safer, more connected, more effective care. Where do you see AI fitting into that bigger picture, especially in terms of integration across hospital and community care?
Yeah, the AI will be one of the forefronts of digital for care, I can see. It's the inevitable future for healthcare is to be more AI, and that was going to require more digital. So they're going to go hand in hand, but AI will never be on its own in a silo. It has to be integrated into the entire system. And so at the moment in radiology, we're lucky, we are very digital, but we don't have the medical records, the electronic health records that we really ideally like. Because you imagine if we married an AI that can see the images plus an AI that can see the medical records, put that together, you'll have a more powerful AI. So at the moment, we're somewhat limited by the fact that we only have digital information in imaging for a large number of hospitals in the country. But once we get a digital for care across the country, then we can really get very powerful AI. But fundamentally, it'll have to be a part of the whole process. AI sitting on its own, for example, is not really the future. It's going to be integrated into care. So for example, one of the tools we looked at was detect fractures in elderly patients. So it's very common for elderly people to come in who trip and fall and maybe fracture their back, for example. They have osteoporosis or kind of weak bones. And so if it's very common that the patient will come in and have an x-ray, and if the AI can flag and say, yes, this patient has an x-ray, also looks like they have osteoporosis, and there's a system there. So there's often a kind of an elderly or a medicine for elderly care pathway for those type of patients. So the AI should be triggering a process to get that patient into the correct care pathway, rather than being on its silo and not integrated to the rest of the health system. So that's the idea. That's really the future, I think, for AI, especially when we have a more integrated digital system where the AI is triggering a pathway appropriately for patients and not requiring multiple emails sent to 15 different people to coordinate that care. The AI should be able to coordinate the care to get the patient the right pathway as quick as possible.
Collaboration between digital and clinical teams is a recurring theme in the success of many transformation programs. How have you seen that collaboration evolve in recent years?
Yeah, so one of the classic role for AI plus or digital imaging or healthcare plus collaboration with a clinical service and patients is stroke. So stroke requires a very coordinated system to get it right because it's all about time. So a patient arrives at the front door, we have to have a system that says this patient is suspected of having a stroke and they need to get into the system quickly to have that stroke diagnosed. So there needs to be a system that goes from the door right down to the treatment. And that it has to be integrated across. And there has to be incredible collaboration to allow that to happen, because it's not just one part of the health service, one department in the hospital is going to do that. So you need the ED triage nurse, the ED team, the stroke team, the radiographers who do the scanning, the radiologists who interpret the imaging, and then the stroke physicians and people who are going to provide the treatment all be part of that pathway. And so by having a system where there's a close collaboration from the very start, we say, look, we're going to integrate something that's going to help us with stroke diagnosis, speed up that diagnosis. There's no point radiology doing that on its own. It has to do it in collaboration across that process. So you get everybody in at the start and you decide what's the best way to do this. Does everyone understand the limitations, the benefits of this potential process? And then once everyone's on board, then you can kind of develop it and you roll it out. And typically the way you do that is like a pilot. You do it tentatively, you build up experience within the team of how this is going to work. You find out the points where it's probably going to fail or people don't understand the best way to do it, and you tease those out and you get it to where it's refined. So now, usually, say for example, the matter, and I'm sure it's true for a lot of hospitals, you come to the front door of the hospital, if the ED triage nurse or the admin staff have flagged a patient as having a potential stroke, they'll go straight to CT without seeing anybody. They'll go straight to CT, and then they'll be seen in the CT room. And that's how you get a super efficient pathway. And then if everything is correct and they should go for a scan, they'll have a scan straight away. So our usual door to CT time might be 7 minutes. Arrive at the front door of the ED and you're having a scan within 7 minutes. So that can be done with close collaboration. And then AI analysis allows us then to analyze all the imaging that's done very, very quickly so that we get a result of all various scans within 2 minutes. A decision made very quickly and they may need transferred to Beaumont or treatment in the hospital. But that close collaboration is kind of key for those kind of more complex processes that need multiple teams.
Peter, what are some of the safeguards and standards you believe are important when embedding AI into routine clinical workflows?
Yeah, the important thing to realize is that AI is not magic and that it has limitations. It is imperfect, not dissimilar to humans, but it's hopefully faster and it's always on. Okay, so it's a really useful tool to have that. It may not be perfect, it may miss things that you think it should detect, but it's there as a second pair of eyes and it's always there and never gets tired. That's really useful, but it is not perfect. And so it is very important in the deployment of these AI tools that there's training around that, especially if you're junior. And so if you're more junior or less experienced, you're more likely to lean on the AI and say, well, I don't know what this X-ray is showing, but the AI says it's normal, it's probably normal. Rather than going, well, it thinks it's normal, that's fine, that's its opinion, and I don't think it's normal, I think it's normal too, that's great, we're matching, we're going ahead with a normal. But not to trust it, not to lean on it, not to make it a crutch so that you actually rely on it. And so if the AI is not there, you leave them out of hospital and you go to a different hospital, don't have AI, you might feel like, well, actually, I feel very exposed now because I've always trusted the AI and made my decisions based on the AI. So it's very important from a training point of view, we use it as an augmentation of what we do, and not a crutch, not something that is going to be making decisions. It'll never be a decision maker, or never is too strong a word, but for the foreseeable future, it will not be a decision maker. It'll be a decision helper. And so that's a really important part of deploying AI in the education around it. And there's going to be huge challenges around that to do that for a whole huge institution like the HSE, because there'll be so many different type of AI tools potentially deployed across the spectrum of booking, scheduling patients, to maybe looking at their medical records and analysing the medical records and coming up with diagnoses, to analysing the imaging, to treatment planning. And training everybody in that is going to be a big challenge. The governance around that is going to be a challenge. But I don't think we should be scared of that either. We should be trying to find ways where we can, find ways where we can limit the risk, but not get paralysed by it. So we've put structures in place that we recognize there are risks with AI, but there are obvious benefits. Just like medications. We know there are risks for certain medications, they have side effects, but we don't ban medications if they have side effects. It's the same with AI. And we shouldn't take a too strict a view on the risks of AI. We should see the benefits and manage the risks.
What would you hope the next generation of clinicians and radiologists will inherit when it comes to the integration of digital tools and AI in their everyday work?
I hope that we see the benefits of AI deployment in patient care, and that it's not deployed because it's a shiny new tool or shiny new toy and we like to play with toys, that they are designed to be safe and to be clinically impactful. And that we make sure we're always, when we're doing something that has some risk, like for example, giving a medication to a patient, that we're weighing up the pros and cons and we're saying there's going to be a benefit for the patient from this. It's not just going to, maybe not just purely benefit me or make me feel a little bit better about what I'm doing. Does it benefit the system or the patient? And it's not to be too isolated, too siloed thinking about AI tools. Because the reality is the future will be, there'll be hundreds of AI tools. And we can't buy them all. The HSE won't have the budget for every AI tool going. And so we're going to have to pick and choose. And so it should be fundamentally about, obviously it's important the healthcare worker is supported. There's a huge problem with burnout at the moment across health services around the world. In radiology, the area I would know about, we are somewhat overwhelmed with the volume of imaging. It's kind of the normal expectation now for patients and for staff is to get a scan. And that's fine and that's great. But we haven't really increased our resources to deal with that demand. And so there's huge pressure on us to get through the imaging quicker and quicker and quicker. And you could argue then that we're going too quick. And then hopefully if you bring an AI tool, we can make it easier for the radiologist to get through those cases. And so hopefully benefit the patient because we're spending a bit more time on cases than we used to in the past. For example, one of the classic ways you could do that is by getting the AI tool to look at the normal cases and say, I'm 99% certain this case is normal. You don't have to spend much time with it. And if that tool was trustworthy with lots of different tests, and we said, you know what, if it says it's normal, we're only going to do a quick sense check of it, but we're going to concentrate on the ones it thinks are abnormal and spend much more time with that than we normally do. So hopefully that is the path to go with AI, that we're constantly doing a sanity check of what we're doing and is it right for the patient, for the healthcare worker, for the system, and because there's potential for spending an awful lot of money in AI and not getting a huge amount of benefit. And that is the risk that we have to be mindful of.
Finally, Peter, what motivates you most in this space and what do you think patients should know about how digital innovation is changing the care they receive?
Yeah, I mean, what motivates me about this is that I think, from my area of particular interest, which is emergency care, I think AI can be clinically impactful. I think it can help patients so that the time from them arriving at the door of the emergency department to getting a diagnosis will be significantly shortened. And also that everything they do will have a second pair of eyes. Every test that they have in the future may not just be imaging, maybe a blood test, maybe an ECG, whatever it is, will have a second pair of eyes. And no matter what time in the morning or in the night you arrive at the emergency department, you'll have that available to you. And so I would hope to reassure patients that, first of all, the AI is not replacing the clinician. It's going to help the clinician. And I don't see the clinician not being always in the loop, always being part of the process. And so that's what I think it's a very common and reasonable worry around AI is that they will have less access to maybe to doctors because everything is just the way, we don't particularly like talking to a call center that's not in the country or different things like that. We want a human contact. And I think the great hope with AI is that we have more human contact, not less. And that the AI will help speed up and improve diagnoses.
Peter, thank you so much for sharing your experience and perspective with us today. It's been inspiring to hear how artificial intelligence is already making a difference for patients and supporting the incredible work of clinical teams like yours.
Thank you.